Hi! For today's video, we are going to discuss what is mood disorder is all about, its disease process, types, signs and symptoms, and even its treatment. So, have you experienced having different moods, emotions, or even alterations in your behaviors? Whether you get yes or no, please continue watching this video until the end. It is normal for someone's mood to change depending on the situation. However, to be diagnosed with a mood disorder, symptoms must be present for several weeks or longer, and mood disorders can cause changes in your behavior and can affect your ability to deal with routine activities such as work or schoolwork. So let me show you an example, or let me show you how it feels like to have a mood disorder. To start, let me ask you first, are you familiar with mood disorder? If not, well, it is a mental health class that health professionals use to broadly describe all types of depression and bipolar disorders. It is a mental health problem that primarily affects a person's emotional state. It is a disorder in which a person experiences long periods of extreme happiness, extreme sadness, or as for the disease process, there are two factors that contribute to the development of the disease, and these are the predisposing factors and the precipitating factors. So the predisposing factors are those factors that are non-modifiable, which means it cannot be changed, such as the age and the sex. The age contributes to the development of the disease because of major life transitions, and as well as the sex, most especially for males, because they have different coping mechanisms than females, and because of the stigma that they are strong and they shouldn't be crying. That is why they cannot easily let go of their emotions and they just keep it to themselves. And as for the precipitating factors, these are the factors that are modifiable or it can be changed, meaning when one of these is altered or eliminated, there's a possibility that it cannot be resulted into a mood disorders. And an example of these are major life changes, trauma, stress, family history, physical illness, or use of certain medications. And as for the etiology, it is a genome-environment interaction disease where factors such as heredity and individuals' environment and experiences contribute to the disease process. So when all these stressors come together, there's the possibility that there will be an imbalance in neuronal activity between the prefrontal cortex and the limbic region of the brain, in which the prefrontal cortex are responsible in helping to regulate the emotions, and amygdala is part of the limbic region of the brain, where it is the one responsible for the release of negative feelings like anxiety and other emotions. And after the amygdala sends a distress signal, there will be a stress hormone signaling that will cause the adrenal glands to secrete cortisol, which we know that as a stress hormone. And when cortisol is released and brain becomes unable to suppress cortisol release due to prolonged stress, there will be an increased circulating levels of cortisol in the blood. It is because the brain cannot control anymore the release of cortisol levels. And when cortisol builds up in the bloodstream, there are two possible it will yield into two possible results, such as the monoamine theory and the neurotrophic factor. Let us discuss first the monoamine theory. So this one, it involves three neurotransmitters responsible for neuroconnectors such as the serotonin, the dopamine, and the norepinephrine. So these three hormones are interdependent and do not function separately. Thus, a decrease in these three neurotransmitters is required for the development of mood disorders like depression, for example. Since serotonin as the main neurotransmitter, it regulates connectivity and communication across the prefrontal region and the limbic region. It also regulates the mood and the levels of the dopamine and the norepinephrine. And since these three neurotransmitters work interdependently, when there is a decrease in serotonin, there will also be a decrease in dopamine and a decrease in norepinephrine. And when the body produces low level of these neurotransmitters, it can cause certain symptoms like anxiety and lethargy. So after that, there will also be a down regulation of the presynaptic feedback, whereas this presynaptic feedback mechanism suppress the release of neurotransmitters from axon terminal or varicosities. Then, it will result to a decrease in neuroplasticity. But before discussing what is neuroplasticity, let us first go back to the other theory, which is the neurotropic factor. Such as just like what I have said earlier, when there is an increased level of cortisol into the bloodstream due to prolonged stress, and since stress blocks the production of BDNF, there will be a decrease in brain-derived neurotropic factor, such as it normally stimulates the dendritic sprouting and new neuron growth. So when this happens, the result will be a malfunction of synaptic plasticity. Whereas synaptic transmission means cells in the brain or the neurons communicate with each other, and this communication will be impaired once there's a malfunction of synaptic plasticity, thus resulting into a decreased excitatory neurons and glutamate, where glutamate is the principal excitatory neurotransmitter in the central nervous system, and it plays a role in fundamental brain functions. And these two theory will then later on result into a decreased neuroplasticity. It will lead into decrease in neuroplasticity, whereas it is the ability of the brain to form new connections and pathways and change how its circuits are wired. So it's possible signs and symptoms will be alteration in emotion, cognition, and behavior, thus resulting to mood disorder. And the next discussion will be types of mood disorder, and it will be discussed by Laika Morales. Like, your turn.
Thank you, Tati, for that very informative and detailed disease process about mood disorder. Now that we have found out what is mood disorder, including its disease process, we will now talk about the types of mood disorder. Major depressive disorder, or MDD, is one type of mood disorder. These often referred to as clinical depression or major depression. These are quite common but of serious mood disorder. It involves periods of extreme sadness, hopelessness, or emptiness, accompanied by cognitive, physical, or emotional symptoms. To be diagnosed with MDD, the symptoms must be present for at least 2 weeks. Another type of mood disorder is dysthymia, also called as persistent depressive disorder. This is a continuous long-term or chronic form of depression. If you have dysthymia, you may lose interest in daily activities, feel hopeless, lack of productivity, you will have low self-esteem, and overall feeling of inadequacy. These feelings will last for years and will significantly interfere with your relationships, works, schools, and daily activities. Next one, we have the bipolar 1 disorder. This is formerly called as manic depression. This is characterized by euphoric or irritable moods and increase in energy and activity. They regularly engage in risky activities that can result negative consequences for themselves and for others. Aside from bipolar 1, we also have the bipolar 2 disorder. There are several evidences that bipolar 2 or BP2 is more chronic course of illness than bipolar 1. It is defined as periods or episodes of extreme mood disturbances that can affect mood, thoughts, and behavior. Its diagnosis requires at least one hypomanic and one major depressive episode. We also have the cyclothymia or cyclothymic mood disorder. It is a mild type of mood disorder which is characterized by mood swings and episodes of depression and also hypomania. Bipolar or related disorder due to other medical conditions, because some other medical condition can actually cause symptoms of bipolar disorder. This type of diagnosis is used to people who has underlying conditions that the doctor hasn't diagnosed yet, and also that is creating these bipolar symptoms. We have also the depression or depressive disorder due to another medical condition, just like we have tackled before. It is about bipolar. This time it is about depression. Similar to bipolar disorder related to another medical condition, this is diagnosis used for people who have the symptoms of depression naman. But the symptoms are caused by underlying condition. For instance, chronic pain, hypothyroidism, and ADHD, all of this can trigger its symptoms. Mood disorders could also be caused by a substance or medication. These are called the induced depressive disorders. These are diagnosed to persons that are experiencing major depressive episode as a result of alcohol use or drugs and medications. We also have the other specified or unspecified bipolar. These diagnoses may be used when a person doesn't meet the criteria for any type of bipolar disorder, but still they do experience bipolar symptoms.
And then for the signs and symptoms of the mood disorder, for the depressed episode, the low mood and then the sadness, or most of the time you feel sad, and then the hopelessness that the things might improve, and then the anhedonia, which is the inability to feel the joy, distractibility and the difficulty of concentrating, the emptiness and the sense of longing for something or someone who has not been lost, the psychomotor functioning difficulties, the significant weight changes, which is waning of gait and then also losing of weight, and then insomnia or trouble sleeping, and or the hypersomnia, which is prolonged sleep, and the sense of guilt, then the sense of worthlessness, and then the suicidal thoughts. And then for the manic episode, this is the feeling of extremely energized or elated, and then the rapid speech or movement, the agitation, restlessness, or the irritability, the risk-taking behavior such as spending too much money or driving recklessly, the unusual increase in activity or trying to do too many things at once, the racing thoughts, and then the insomnia or the trouble sleeping, and the feeling of jumpy or on the edge for no apparent reasons. So that's all for the signs and symptoms of the mood disorder.
Hi, I am Marjorie Magalona, and I will discuss the treatment and therapy of mood disorder. Of course, the treatment will be depend on the symptoms and the present illness or condition of the client. Here in treatment and therapy of the mood disorder, acute psychiatric hospital-based care recommended when the client's mood disorder is severe or in danger for self-harm. There are supportive psychotherapy and millennium management. Brain stimulation therapies are thought to work by causing changes in the chemicals in the brain that are known to be associated with symptoms of depression and bipolar disorders. There are several types of brain stimulation therapies, including the following. Our first psychotherapy is electroconvulsive therapy or ECT. It has been used to treat severe depression or bipolar disorder in cases when medication or psychotherapy have been unsuccessful. So here in psychotherapy, it involves a brief electrical stimulation of the brain while the patient is under anesthesia. So here, it gives a muscle relaxance. Electrodes are placed in a certain location of a scalp or forehead. Here in ECT, the client may have memory loss or confusion, headache after procedure. The next is the light therapy. Here in light therapy, there is a technique has been long used to treat sad or negative emotion. It is based on the idea of supplementing natural sunlight with bright artificial light during fall or winter. Because light therapy may cause chemical change in the brain that lifts your mood. Because bright light increases mood, positive neurotransmitters such as serotonin that stimulates mood. Each morning, the person is exposed to the artificial light for about 20 to 60 minutes. That light is about 20 times more intense than regular indoor lighting. So this light therapy must be common use in abroad or in a place that has a four season. And next is the repetitive transcranial magnetic stimulation or RTMS. This non-invasive procedure uses magnetic coil to apply short electromagnetic pulses to specific nerve cells in the brain. The magnet is positioned against the forehead while the pulses are sent through the skull. The procedure is used to treat major depression for patients who do not respond at least one antidepressant drug. So here it uses magnetic field pulses can gradually change the activity level of the stimulated brain region. Usually sa brain region niya is here in the prefrontal cortex. Then next is the cognitive behavioral therapy. It is a form of psychological treatment that has been demonstrated to be effective for a range of problems including depression, anxiety disorder, alcohol and drug use problem, and other mood disorders. It is an approach includes identifying and challenging the accuracy of the client's negative cognition, reinforcing more accurate perception, and encouraging behavior that are designed to counteract the depressive symptoms. Then next is, of course, the medication. This medication includes antidepressant, neuroleptics, psychotics, symptoms, or mood-stabilizing agents. So, this medication include triglyceric antidepressant, monoamine oxidase inhibitor, selective serotonin reuptake inhibitor or SSRIs, and mood stabilizers. And our last, of course, the client has a community-based treatment. It is adequate rest and exercise, good nutrition, stress management, use of support systems, verbalizing rather than internalizing feelings, and assertive training programs. So those are the treatment and therapies for the patient with mood disorder. And that's all. Thank you.